In today's GBMC RX prescription for a healthier you, colorectal cancer. Here with what we need to know is colon and rectal surgeon Dr. Valerie Cabrera Leon. Hello, and happy to have you here.
Hello, thank you so much.
Thank you for being here. So let's just start out with the beginning. Define the difference between colon and rectal cancers.
Yes, colon cancer is actually the upper part of the large intestine,
Okay.
and then the rectum would be the lower part of the large intestine.
So connected but separate areas.
Anatomically, yes, and for surgery-wise, there's a difference too.
Okay, well, tell us, what are some of the common symptoms that people should watch out for?
Yes, very important would be blood in the stool,
Okay.
abdominal discomfort, any change in the bowel habits, meaning constipation or diarrhea, that's concerning.
And then explain why screenings like colonoscopies are so important and when we should start to get them, because sometimes we hear one age or it depends on our family history. So walk us through that.
Yes, nowadays it's 45 years old if you have average risk for colon cancer.
Okay.
Why is so important? Because in colonoscopy, we actually can take what is called a polyp. Usually cancer grow for those polyps and we can remove them before they become a potential cancer in the future. So it's very important to watch out for those growth of polyps.
So getting in front of it beforehand is really, it can be a life-saving measure.
Yeah, you're potentially, curing yourself from cancer even before having it. So for us, it's amazing, to take it on time.
Absolutely. And then talk about the newer screening options, because there are some new ones here, and how effective are they?
Yes, there are fecal-based tests. The most common is Cologuard.
Okay.
That's a test that it's done in the stool to actually see if there's any microscopic sample of stool, or if there's a concern they can be a polyp or a cancer. They are like 92 sensitive tests.
So I'm sorry, I want to make sure that I understand.
Yeah.
If they test this, they might be able to see if there's microscopic traces of what? The cancer itself?
Of cancer, polyps, or a cold blood, right? Because it's an unspecific test. There's not a specific way to know which one of them, but definitely will alarm us to actually do a colonoscopy.
Right,
in the
it tells you to
future.
look further. Wow.
Correct.
Okay, so that's one of the new, are there any others right now, or is that the one that's?
That's the most, a higher sensitivity. There's another one that it only detects a cold blood microscopically.
Okay.
The other would be what we call virtual colonoscopy, CT colography. That's usually done when, by some reason, the colonoscopy cannot be performed in a patient.
Wow, there's so many options. These things
Yes.
have come a long way over the years. What are some of the risk factors for developing colon or rectal cancers? And then are there any ways to reduce those risks?
Yes, definitely. There's risk factors that we can modify: high meat intake, high processed food, smoking, increased alcohol intake, slow physical activity, and obesity. Those things we can definitely modify, and a high fiber diet. Those things can be modified, right?
And
in
help
order
reduce your risk
to-
then.
Yes, reduce all of those factors, and having a high fiber diet, fruit, vegetables, at least having like 30 grams of fiber will be beneficial for the patient.
That's good to know, because I think we just want to make sure that we're staying healthy before anything is detected.
Yes.
If something is detected, though, what are some of the treatment options?
So it will depend on the stage, if the cancer is localized to the colon, or unfortunately if it's spread. So there's, treatment between surgery, chemotherapy, immunotherapy, but it will depend on the specific patient, how healthy they are, in order for us to target a specific treatment for them.
And we talked, of course, about the early detection, but when you do have early detection, how much does that help improve the outcome for patients overall?
Yes, definitely. The earlier we detect it, even before we have a polyp, it's just a matter to remove it, right? And it's going to be less invasive treatments, right? Maybe just a surgery versus that we need to do more invasive systemic therapy if it's more advanced.
All right, doctor, I want to thank you so much for this very helpful and insightful information. Of course, you can get more information by visiting gbmc.org/colon. We'll be right back with more Midday Maryland right after this. Stay tuned.